This is like everyone. Hi, and look at this amazing background. I'm with Kevin, and I like his Hippo T-shirt.
Why, thank you.
Yeah.
Appreciate it.
Especially because it's about Hippo Health, right? And it's. Can you introduce everyone? Yeah.
Sure, yeah. Hey everyone, I'm Kevin, one of the co-founders and CEO of Hippo Health. We are a new startup here in Boulder, and we allow you to get access to a top local trusted physician in a matter of minutes on your smartphone, laptop, iPad. So healthcare is, as we were talking earlier, a little bit of a mess these days.
Uh, and I just want to talk about Boulder first. It's like, why do you love Boulder so much? It's fun, and we'll talk about everything else in between as
Yeah,
well.
cool. Boulder's great. It's just a unique community right next to the mountains, and just a ton of entrepreneurial culture and history with a lot of brilliant people that are of the entrepreneurial mindset and really want to do something big. And so some really neat startups that are happening right now all around the community here in Colorado, and Boulder's definitely one of the spots that's got some really cool stuff going on.
That's really cool. Early on, we mentioned something really awesome in terms of how messed up the healthcare system is, and that's where your app, I feel like, is providing better service and better connections between people and doctors and physicians.
Yeah, I mean, we want to try to just get back to basics of empowering the patients and the providers to have an easy, simple dialogue and communication stream. We're a team of local emergency physicians. We've all been practicing together here in Colorado for the past 15 years or more on average. And we really believe that by cutting out a lot of the bureaucracy and unnecessary overhead and costs that we see in a lot of healthcare, you can get back to the basics of just simply empowering the providers in the community and the patients to just be able to connect with each other.
Do you think there's a lack of connection happening between people at the moment?
I think it's a common problem. I think our healthcare system has really been set up around an incentive structure that sometimes doesn't always reward relationship-driven medicine. And we really want to try to get back to the way healthcare was 50 years ago.
What was healthcare 50 years ago?
It was less complicated. There was less overhead, less administrative bureaucracy, and there was a lot more leadership provided by the providers doing the work and the care.
What's it like, the jump between being a doctor and being an entrepreneur, or even startup?
It's very different. It's been exciting, scary, fun, just learning tons. So just like when I was learning medicine, it's just a brand new world in a way. And I trained as an emergency physician, so we got trained on how to take care of very high-risk situations when someone might be at risk of dying in a pretty rapid fashion. And with startups, it's a high-risk proposition, but a very different set of risk factors that can play out over a period of months, weeks, years even. So.
One final question.
Yeah.
It's how is Hippo Health different and unique from all the other health apps?
Right. Yeah, so like we were talking earlier, there are probably 300 telemedicine companies around the country right now.
And just to emphasize, what is telemedicine?
So telemedicine, telehealth is basically being able to access healthcare via any sort of technology modality, whether it's your smartphone or internet, video, audio, wearables. All those things are really starting to converge more and gain acceptance. So right now, about 3% of Americans have tried telemedicine or telehealth, and it's similar numbers to what we saw with the internet back in the mid-1990s. Just a few million folks were on the internet back then, and you can see a few more people are on the internet these days. So.
Okay. And going back to the questions, how are you unique?
Yeah. So we're unique in that we're really focused on a telehealth service that is provider owned and led. Really, from what we've seen in the market, all the other telehealth services that are out there tend to be focused on the technology and really being led by folks that may not be providing the care all the time. So we've been very intentional about creating a model that allows the providers to really be the owners and the leaders of their local service. We really think that creates a model that empowers the providers to go the extra mile for their patients and helps them leverage their relationships in the community where they can make better referrals, better follow-up, better continuity of care. And our hope is to ultimately better connect all the providers around the state with that model.
Okay, how do you deal with data? Because health data is still something a lot of people talk about. Do you own it, or how do you deal with it at the moment?
So we have a HIPAA compliant platform. We keep all of our data internal. We don't sell our data, anything like that. Our model and our mission is really focused more on the patient care side of things. Ultimately, we're working with our own data to better empower the providers around some unique algorithms. But right now, we're mainly focused on kind of the MVP of just connecting our local physicians with folks in Colorado.
Where can people connect with you, and how can they learn more about Hippo Health?
Yeah, so you can go to hippohealth.com and you can check out our website, learn more about our physician team and all our local folks that are leaders on Hippo. We'll be going live in about 3 weeks.
Oh, I'm excited.
Thanks. Yeah, we are very excited right now, and I think just check out on the website. We're actually offering up a promotion where you can sign up now with the promo code FREEHIPPO and get 1 month of free access to just try it out and see if it's of value to you.
So you're using a SaaS model?
So it's a service business that's empowered by software.
Yeah, it is. So it is a SaaS model. Yeah. All right, thank you so much for connecting with me, and good luck with the MVP. Right.